Hi there, my name's Hamira Sultan. I'm a public health consultant and I also lead our Future Parks Accelerator programme here in Birmingham called Naturally Birmingham. If I had one piece of advice for anybody wanting to work in the world of green spaces, I would say don't let the fact that you're not an expert put you off. I absolutely am not a green space expert. I haven't had any formal training in it, any formal qualifications. But what I have is passion for it, and I can see the benefit that green spaces brings to people. So don't let that put you off, because you can learn all the kind of things that you need to learn about green spaces on the job that you do as well. If I can just finish by saying one of the things that I have led my life by is not to be scared about trying things and just seeing what happens. My son and I, Isa, actually planted an acorn to see what happened, and about 3 months later we now have a baby oak tree that is growing on our windowsill at home. So I hope you found this video useful and it inspires you to think about green spaces as a career for you going forward. Thanks. So my job is really about making sure that green spaces are a part of everyday life for people in Birmingham, whether that's a part of their home, whether that's part of their education, so part of their school life, their nursery, their early childhood, part of their opportunity to learn about skills and the kind of work that they do, and also as part of any activity to increase their health and well-being. So essentially my job is to make sure that green spaces features really, really highly in people's lives. And to do that, I work with a whole range of different departments within Birmingham City Council. So within inclusive growth, within housing management, the employability team, the education team, Birmingham Children's Trust, public health, and lots of other organisations as well. So Birmingham Open Spaces Forum, the Active Wellbeing Society, the list is quite endless really. In terms of who inspires me, I'd say that has to be my little boy, Isa, who is 3 years old. I remember when I was growing up, I don't really have any memories of being in green space or parks. It really wasn't a part of my life growing up. It wasn't a priority, I think, for my mum, who was working really hard as a single mum, as an immigrant, to make sure that I got the best education that I could. And it's only really as I've gotten older and become a mother myself, and I'm lucky enough to live in a part of Birmingham where there's a huge amount of green space, that I've really been able to see what it can do for us as a family. We've created so many memories of Isa taking his first steps in our local park, learning to ride his bike, even me learning to ride a bike as an adult. Has all been made possible because of where I live and the fantastic green space that I have around me. So one of the things I really love about this job is I've gotten to meet so many different people I don't think I would have had the chance to have met if I did a different kind of job. And that's because green spaces is everywhere, and the ability to benefit from green spaces is absolutely everywhere as well. So I've gotten to meet people from employment, from different kinds of housing groups, different community organisations, and just being able to hear all the wonderful things that they do. I feel really privileged to be able to do that. So how did I get to become a public health consultant? Well, I did my A-levels in biology, chemistry and psychology, and then I went on to the University of Sheffield to do a degree in genetics. And after that, I actually decided to pursue a career in drug discovery. I wanted to work in the field of healthcare somehow, and I thought helping to discover drugs against diseases would be a good way to do that. I did that for about 3 years, and then I actually decided that I was more interested in helping people to improve their lives, change their lives, and actually try and prevent them from becoming unhealthy in the first place. And that's where public health really stood out for me. I left that job, did a master's in public health, got a public health job at a local primary care trust, as they were known then, and then actually applied for specialty training for public health. That took me about 4 years, and after that I became a consultant, and I've been a consultant now for 5 years. And public health itself is a massive, massive field. You can be involved in helping hospitals change the way in which they deliver services. You can get involved in actually buying services to help improve people's health and well-being. So things like helping them to stop smoking or to manage drug and alcohol problems. But the kind of public health that I'm really, really interested in is the one that's about changing people's environment. Because I absolutely passionately believe that if we help, in order to help people lead healthier lives, we need to change the environment that they live in. And for me, green spaces is really, really important for that.